This is a Doc Talk podcast short with Dr. Jenna Burton and me, James Piecowye.
We did have a nice long break from coughs, colds, whatever during COVID. And now it's time for us to share the love again. And so people have got properly sick. Also, it depends each year on what our lovely friend, the flu, is doing. And what we've found this year is there is a lot of people that have been vaccinated for the flu jab, which I still would always advise because it will cover you for a number of strains of the flu. But there is a particular strain of influenza A that seems to just be unvaccinatable, and people are still catching it despite being vaccinated. If you have been vaccinated, it would appear as if the symptoms are a little bit less, but the amount of prescriptions that I'm making for Tamiflu, which shortens and reduces the severity of the illness, is remarkable. In fact, James, if I was to lean into my bag now where I can't access it, I'm also taking Tamiflu because I felt like I was starting with symptoms and my office has been so full of flu. And I get really impatient when people say, "Oh, doctor, I've got the flu." And I think, you've got a heavy cold. You haven't got the flu.
Okay.
The flu's quite serious.
Let's put on pause and let's back up. Cold versus flu. What are the different symptoms? How can we, just get it sorted in our minds that, I just have a cold? Because as soon as people start coughing, and anecdotally, and not that I would ever say anything about Steve Braden, who's in, Kingston, Ontario, Canada, who, would possibly have a cold and is like doing rapid testing constantly because I want to make sure I don't have the vid. It's like, dude, you can get a cold. And everyone's like, oh, it's because maybe it's just a cold. It's like,
yeah. And surprisingly, colds are very, very common. So the easy way of thinking of it is the flu is a really severe version of a cold. Okay. So a cold is an upper respiratory tract infection, congestion, feel generally terrible, quite lethargic, bit of a sore throat. Again, maybe a bit of a cough. It could be wet or it could be dry, depending whether your secretions from your upper airways are sort of hitting your chest. But people can, if they push themselves, they probably could still go to work. They don't tend to have fevers. Okay. Probably still all right to eat, So generally they can about execute their activities of daily living, even if it's a bit miserable for them. The flu, no. There's none of that. There's in bed, they're having fevers. They have no appetite. They're completely drained. Their whole body is aching. Sometimes they even have some nausea, even some vomiting. It might kick off a migraine if they are susceptible to that. They generally feel like they're dying. And flu can put you in hospital if it's severe enough. So flu, it can be really nasty. Now, the strain that I'm seeing, people are clearly exceptionally unwell. Really? And they look dreadful. And all they want to do is go to bed. Wow. However, luckily, in touch wood, I haven't seen anyone that sort of deems fit for hospitalization as yet. But there's still time.
How long does the flu typically last?
It can last anything between like a week to 2 weeks for sort of a typical bout.
To 2 weeks.
Yeah, but the thing is that I'm talking for the recovery time as well, to sort of get back on your feet. Because often when you've been very poorly, you have to build up your strength again, especially if you've not been eating, you've been having fevers. Yeah. So I would say for most people to actually be ill, sort of 5 to 7 days, but to then get back into the normal swing, get back to exercising, back to work, it can be anything up to 2 weeks. And everyone's different. It can be longer or shorter depending on the strain that they have, how they've coped with it, if anyone else is ill in the house, etc. So, and the joys with Tamiflu, which is an antiviral medication that we're not privileged enough to have in the UK, we don't get it on the NHS, is the results are remarkable of how quickly it can turn people around. So only really works if you catch it you start taking it within the first 48 hours of getting
the first 48 hours. So you have to be on it. You have to be honest with yourself. It's like, this is the flu. My joints are just, I'm starting to feel, get the Tamiflu into you.
Well, you can go to the doctors and get a swab to check whether you have got flu, influenza A or B. Okay. But also if, say for instance, let's hope this doesn't happen, James, but if Donna had the flu and she was positive, then you start to think, I'm starting to feel a bit, get on the Tamiflu, because, you've had a heads up as to what's coming. So that tends to be the time that we prescribe Tamiflu. And it's not really for children, it's more for adults. So children don't tend to need it. They do usually bounce back a lot quicker from the flu. And everything, actually.
How long do you take the Tamiflu for?
If it's prophylactic, so if it's to stop you getting it, it can be up to 10 days. And if you feel like you've already been, or you have had a positive diagnosis of influenza, then it's just for 5 days. Just one tablet once a day.
Wow. Okay, that's easy.
And I've not been sponsored by any pharmaceutical brand either today. That's just me saying, it's a drug.
I think this is yet another opportunity. I always say this with the podcast because we are not sponsored by anyone. But hey, I am not against a pharmacy saying, "Hey, we want to sponsor your podcast," and giving them a little plug.
I might be against it, James. It's a little bit unethical for me. You take the money, you take it, you can do the advertising, and I'll just come in as a third party.
Or the clinic, a clinic, a health bay says, "Hey, we want to sponsor a podcast." Or where are you at, by the way? Where are you at now?
Oh, James, you've gone.
No, I'm here. Keep going. I'm here. Keep going. Where are you? Can you hear me?
I can hear you.
Where are you located? Where's your office now?
I am on Elwasle Road in J3 Mall in Cooper Health Clinic. And I usually have a really, really nice, bright office, but we were explaining before, there's a big UAE flag outside. So it looks like it's nighttime here, but it's not. It's only 9 a.m.
Okay. Cooper Health Clinic. That's good to know. One other thing, when you are diagnosed or you figure you have the flu, whether it's whatever strain, what are the things aside from taking antivirals and things like that, what else would you recommend as a doctor for us to do? We've already had a great podcast about colds and coughs. What is your standard recommendation for patients?
Rest. Hydrate. So a lot of people aren't happy unless they go out with a bag that is literally like clicking together with pills. But the reality is it is a viral, it's a viral illness. I always say, don't underestimate the value of a good paracetamol tablet.
Okay.
So paracetamol, it is anti-inflammatory. People don't realize that it does have anti-inflammatory effects. It also can help manage the fevers. So paracetamol, rest, hydration. Don't force yourself to eat, but try and eat when you can. And if you're really not eating, try and get yourself like a Gatorade or a Lucozade, which has got lots of electrolytes, some sugars, and also the water as well. So at least you're getting something in kind of through the severity of the illness. If you really have got that deep muscle aching, providing you're not asthmatic, that you don't have any contraindications to taking a non-steroidal anti-inflammatory like a stomach ulcer, then take an ibuprofen or something as well.
Okay.
Some people with the congestion want to take something like a spray to sort of try and relieve the congestion. That's fine. There are many different branded type sprays. You're looking for one that's got phenylephrine in, which helps to cause vasoconstriction. So basically it stops the blood supply as much to the nose, which reduces the secretions, or even just a simple saline spray to help wash out the area. But really, when someone has the flu, that's kind of like the least of their concerns because they generally feel so unwell. And then it depends on individual symptoms. If somebody has really bad nausea or vomiting, then it'd be giving them an anti-sickness. So it becomes more individually sort of prescribed then.
Are you finding with the patients who are coming in right now with flu that it's running rampant through the household? It's hitting one and then the other and then the other, falling like flies?
One lovely lady yesterday said she was going to get a monthly subscription to my office because I think it was the 4th or 5th time she'd seen me in that week. I felt so bad for her. And we tried to do like sort of proactive medicine, knowing what was going to come. But ultimately they still one by one ended up having to come in for something. So yeah, it's literally running rampant, and it's a shame because it's also going through the schools, it's going through the workplaces, and as much as children bounce back, they also take a deep dive quite quickly as well when they get really sick. What it is with children, they can compensate for ages, and this is the same case for really severe illnesses with children, where you have to be very careful with them and exercise extreme caution when they're ill. Because they're young, they're able to compensate for their blood pressure, their heart rate, everything really well until they can't anymore, and then they go downhill quite quickly. So it's really hard to see the little ones that are suffering because they, sometimes they don't understand.
Yeah.
They just feel dreadful. They just want to feel better. And you can see the parents thinking, I wish it was me. And I'm thinking, well, it will be in a few days.
Yikes. I mean, it's just, I'm looking at the date and it's still early in the year when I think flu seasons and things, I always think, February, March. I'm not thinking early in the year. We're going to date stamp us a little bit here because we're in November, but is it early?
No.
No,
I'd say from September. Also, don't forget my background is from the UK. So as soon as September came, the weather took a dip. Anyone that had COPD or was a heavy smoker, etc., they'd all go down with the flu or start getting sort of the chest infections. And this would be the time, this is the real time from September onwards when it's like flu jab season. So maybe the reason you're thinking later on is maybe these are the people that haven't been jabbed. But for me, it's like that's when you start thinking about flu seasons kicks in and everyone should be having their flu jab. And I think, one of the things I'd say about COVID is there was a lot of controversy regarding the vaccine, and a lot of pro-vaccinators have started to become a little bit anti-vax generally, and their fears about the vaccine for COVID seem to have carried over to other vaccinations, including even simple things like the flu. And it's like this is a long used vaccination. It's an old school method. We've had generations of people that have had the vaccine. This isn't one to be concerned about. There's nothing to suggest that there's anything to worry about with the flu vaccine, and yet so many people are now avoiding taking it, which is a real shame.
It's so true. And I wonder, as you said, there's one strain that's not really being hit by the vaccine. And the vaccine is kind of devised a year in advance, looking at the trends and looking what's happened. Often Australia way gives us a little bit of a clue of how it's going to work. So there is a bit of guesswork in it, but it is quite a broad spectrum, and usually it hits pretty well. So let's hope.
Yeah, it's even though there will always be the odd strain that's not covered. Let's just think, well, maybe there was a strain that was in there that could even be more fatal or have worse symptoms. It's always a good idea, especially if you're pregnant, you're immunocompromised, you are a child, you are asthmatic, or you have long-term lung disease. All of these people, the most at-risk groups for the flu, might not just get rid of it as quickly as everybody else. Definitely be getting your flu jab.